Hello future physios, welcome to part 10 of our comprehensive electrotherapy series. I'm Vaishak, and if you are new to the channel, this is our go-to destination for mastering physiotherapy competitive exam across India and the Gulf countries. What new in this series space? We have successfully covered the foundational concept of electrotherapy in our previous 9 parts, and now we are entering into an exciting new phase. From part 10 onwards, we are diving deep into specific electrotherapy equipments and modality, giving you 20 high-quality MCQs with detailed explanation for each topic. Today's focus: intermittent compression and edema management. In this episode, we are exploring one of the most clinically relevant topics. Whether you are preparing for DHA, MOH, Prometric, or any Indian government physiotherapy exam, these 20 carefully crafted questions will test your understanding of edema pathophysiology and classification, lymphatic system function, intermittent compression parameters and protocols, indications and contraindication, clinical application and safety consideration. Before we begin, make sure you grab a pen and paper, attempt each question yourself, then check your answer with detailed explanation. Do not forget to subscribe and hit notification bell to never miss an update from our electrotherapy series. Question number 1. Which of the following best defines edema? Option A. Accumulation of excessive fluid in the intercellular space. Option B. Presence of abnormal excessive amount of fluid in extracellular space. Option C. Accumulation of blood in arteries. Option D. Excessive protein loss in urine. And the answer is Option B. Presence of abnormal excessive amount of fluid in extracellular space. Now let's move to question number 2. What is the main function of lymphatic system in edema management? Option A. To produce red blood cells. Option B. To collect the return and excess extracellular fluid and plasma protein to venous system. Option C. To regulate blood pressure. Option D. To synthesize hormones. And answer is Option B. To collect and return excess extracellular fluid and plasma protein to venous system. Now let's move to question number 3. Which of the following is a characteristic of pitting edema? Option A. No pit is formed on pressure. Option B. Pit disappears immediately after pressure is released. Option C. Pit remains for long time after pressure is released. Option D. Only occurs in presence of infection. And the answer is Option C. Pit remains for long time after pressure is released. Now let's move to question number 4. Which of the following is not a method of edema management described in the PDF? We'll be attaching the PDF in the Telegram channel. Now let's move to option A. Rest, ice, compression, elevation. Option B. Application of intermittent compression device. Option C. Use of diuretics as first line of therapy. Option D. Muscle contraction, exercise. And answer is Option C. Use of diuretics as first line of therapy. Now let's move to question number 5. What is the recommended pressure for intermittent compression device in edema management? Option A. 10 to 20 mmHg. Option B. 70 to 80 mmHg. Option C. 50 to 60 mmHg. Option D. 30 to 40 mmHg. And the answer is Option D. 30 to 40 mmHg. Now let's move to question number 6. Which of the following is a contraindication for intermittent compression therapy? Option A. Lymphedema. Option B. Vein thrombosis. Option C. Traumatic edema. Option D. Chronic edema due to inactivity. And the answer is Option B. Deep vein thrombosis. Now let's move to question number 7. Which method is most effective for preventing edema formation after acute injury? Option A. Only rest. Option B. Heat application. Option C. Immediate weight bearing. Option D. Rise approach, rest, ice, compression, elevation. And the answer is Option B. Rise approach. Now let's move to question number 8. Which of the following mechanism does not help move lymph through the lymphatic system? Option A. Skeletal muscle contraction. Option B. Respiration. Option C. Elevation above the heart level. Option D. Direct nerve stimulation. And the answer is Option D. Direct nerve stimulation. Now let's move to question number 9. What is the typical on-off time sequence for intermittent compression device? Option A 1 minute on, 4 minute off. Option B 4 minute on, 1 minute off. Option C 10 minute on, 10 minute off. Option D 1 minute on, 1 minute off. And the answer is option B 4 minute on, 1 minute off. Now let's move to question number 10. Which of the following is not an effect of prolonged edema? Option A pain. Option B increased joint range of motion. Option C delayed healing. Option D impaired function. And the answer is option B increased joint range of motion. Now let's move to question number 11. Which of the following is key characteristic of non-pitting edema? Option A deep pit forms and remains for a long time after pressure. Option B, it's primarily caused by increase in venous pressure. Option C, the edema is soft and easily displaced. Option D, no significant pit is formed when the pressure is applied to the skin. And the answer is option D, no significant pit is formed when the pressure is applied to the skin. Now let's move to question number 12. Which of the following is not an indication for intermittent compression? Option A, lymphedema. Option B, traumatic edema. Option C, severe cardiovascular problem. Option D, chronic edema secondary to inactivity. And the answer is option C, severe cardiovascular problem. Now let's move to question number 30. What is the main mechanism by which compression reduces edema? Option A, decrease in lymphatic flow. Option B, increase in extracellular pressure, pushing plasma and protein into lymphatic capillaries. Option C, increases blood viscosity. Option D, reduce plasma protein concentration. And the answer is option B, increases extracellular pressure, pushing plasma and protein into lymphatic capillaries. Now let's move to question number 14. What is the typical duration for single intermittent compression section? Option A 1 to 5 minutes. Option B 10 to 30 minutes. Option C 1 to 2 hours. Option D over 5 hours. And the answer is option B 10 to 30 minutes. Now let's move to question number 15. Which of the following is not a contraindication for intermittent compression? Option A fracture. Option B local infection. Option C renal insufficiency. Option D mild lymphedema. And the answer is option D mild lymphedema. Now let's move to question number 16. Which of the following is a sign that lymphatic capillaries are over-distended? Option A increased lymphatic flow. Option B stoppage of lymph flow and accumulation of excessive fluid. Option C rapid dissolution of edema. Option D decreased osmotic pressure in tissues. And the answer is option B stoppage of lymph flow and accumulation of excessive fluids. Now let's move to question number 17. Which of the following is a method of compression used in edema management? Option A lymphatic massage. Option B use of diuretics. Option C only rest. Option D heat packs. And the answer is option A lymphatic massage. Now let's move to question number 18. Which of the following is not a way lymph is moved through lymphatic system? Option A skeletal muscle contraction. Option B respiration. Option C elevation. Option D passive diffusion. And the answer is option D passive diffusion. Now let's move to question number 19. Which of the following is a complication of long-standing edema? Option A improved healing. Option B pain and decreased range of motion. Option C increased muscle strength. Option D enhanced lymphatic drainage. And the answer is option B pain and decreased range of motion. Now let's move to question number 20. Which of the following statement about intermittent compression is false? Option A, it is indicated for lymphedema. Option B, it should never reach systolic blood pressure. Option C, it is contraindicated in fractures. Option D, it is recommended for acute deep vein thrombosis. And the answer is option D, it is recommended for acute deep vein thrombosis. So that's all for today. If you have any doubts, please do mention in the comment box. I have given the explanation in the description box and detailed explanation and the PDF inside the Telegram channel. Please do read it. I'll be back with next topic, that is hydrotherapy, whirlpool bath, herbal tanks and so on. Please do learn this and all the best for your exams and thank you. Bye bye.